Yes, we're going to talk about Bowen family therapy and and systemically how individual therapy is a little bit different from family therapy. One of the things that you have to realize is that in Western society, as counseling is concerned, most of the counseling programs focus on training um, new counselors and therapists on individual approaches and focus a lot on the individual therapeutic approaches and theories, whether it's Freud, Adler, Jung, behavioral therapists, um, reality, CBT, DBT, REBT, um, the humanistics with person centered, existential, or Gestalt. Um, they're all the individual approaches, all about the individual achieving optimum um, levels of acculturation. When it comes to family systems, is you have to go away from the individual as the center and the unit, but the family or the system is the unit, and the way of thinking of it is like totally different because with the family system, what you'll be thinking is that the overall whole is 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 more um, in unison than the individual parts. So what that means is that it's like the whole is more um, real and more unified and more stronger than each individual part if you were to add them up because they'll still be individuals. So what you have to do is look at it to where it's like you're not going to be able to change one thing in the system without the system adjusting and changing. Where you can change that one individual and things will go good for them, but the thing that the system that it's in will maladapt and change over to be compatible with that individual again because now a whole lot of things going out of whack. Okay, so um, we're going to briefly talk about um, the one of the therapeutic approaches that's Bowen. Some of the limitations with any family therapy, not just Bowen family therapy, is the critics of the family therapy have indicated that such therapy often reinforces stereotypical roles for women and men, parents, and their children because it's based off a patriarchal Western viewpoint and the white supremacy idea that the nuclear family is the standard bearer for what a family is supposed to be. Okay. Um, there are distinctions between the various family therapeutic approaches have start slowly becoming blurred. So it's like uh, the distinct things you see in individual therapeutic approaches, you're starting to see less of them distinct differences in family systems. Okay, um, there are more subtle differences than distinct, and much of the early influence of family therapy can be attributed to its charismatic leaders who are no longer with us. One of the first things you have to do when you're dealing with abstract terms like family is what is the definition of a family? And for this, you got to look at the culture you're in because each culture has a different definition for families, right? So, what constitutes a family in one culture, one ethnic or racial group, might not constitute a family in the other. So, it's like usually it's more distinctive and more inclusive in different cultures. Okay. Um, European Americans emphasize the importance of nuclear family, the mother, the father, the children, right? Only individuals who are blood related are considered part of the family. When it comes to African Americans, it varies, but usually African Americans are more inclined to have a more extended and informal network of kin and community, and they include close and long-term friends as family. Um, and Asian Americans and Native Americans include ancestors and all descendants as family members. Family therapy is both similar to and different from individual therapy. Individual treatment approaches tend to minimize the relational, social, and cultural systems that may contribute to mental disorder. In family therapy, the family rather than the individual is the primary unit of concern. The whole is greater than the sum of its parts. That's one of the biggest uh, mantras to remember when doing family systems approaches. That the whole is greater than the sum of its parts, and when you're looking at a family, the whole of the family is what you're trying to achieve, right? Not the individual members being in the family. You're trying to get a whole, inclusive, encapsulated thing of a family. Um, but at the same time, you still want the individuals to be differentiated in the family. I'll get into that a little later. Individual parts of the system can be best understood primarily within the context of the whole system. Human behavior operates within the social system, and notions of a circular, simultaneous, and reciprocal cause and effect are used to replace traditional models of linear cause and effect. Change in one part of a social system with one family member can and will influence the entire system. Um, Systems seek harmonious and equilibrium. Families seek stability, homeostasis, or an equilibrium, and sometimes this works to prevent family change. Therapist interventions from an interpersonal or family system perspective must be on the family system level rather than on the individual level. When it comes to postmodernism, and it's very important to talk about postmodernism when we're talking about family therapy. Excuse me. Postmodernism has had an important influence on family therapy, and this influence is steadily increasing. Well, some of the tendencies of postmodernism include the questioning of objective reality, importance of language in everyday meaning making, and the social constructs of reality, and an emphasis on contextualization. Family therapists who subscribe to the influence of postmodernism reject the idea that there is a singular objective descriptive of family functioning. Um, Dr. Murray Bowen and multi-generational family therapy looks at a few key components and some of the issues that you might deal with uh, when it comes to this therapeutic approach. Ooh, excuse me. Differentiation of self is when an individual's ability to distinguish themselves from their family of origin on an emotional and intellectual level. Okay, so the differentiator of self deals with a person's ability to spare his or her own intellectual and emotional functioning from that of the family of origin. When individuals have a low differentiation of self, they are more inclined to become fused with predominant family emotions. Individuals with low self differentiation depend on others' approval and acceptance to feel good about themselves. Um, triangulation, a triangle in the Bowen multi-generational family therapy is a three-person relationship system. It is universal unit of analysis in working with families. And when two people in the family have problems with each other, one of them or both of them will triangle in a third family member to help one of the persons to respond to the anxiety between each other by shifting the focus or bringing in a third person. The nuclear family emotional system, when two people with low self differentiation marry, they tend to become highly fused and produce children who are also highly fused. Because of this fusion, it creates an unstable environment. It produces one or more of the following situations. One, reactive emotional distance between the spouses. Two, physical or emotional dysfunction in one spouse. Three, overt marital conflict. Four, projection of the problem onto one or more children. Um, when we look at family process, projection process, this is a process that it helps enables parents to transmit their lack of differentiation onto their children. A child who becomes the object of a parent's projection becomes the one most attached to that parent and the one with the least amount of self differentiation. Multi-generational transmission process is basically saying that um, the issues you have now within your family is not unique to you and now, but it's been happening usually within that family, excuse me, and within that family for years and generations to where it's like you might not even start noticing it anymore. It's been so made common within your that person's family structure. Emotional cutoffs are it represents the mental devices people use to reduce anxiety from their many unresolved emotional issues that they have with their parents, their children, their siblings, and other members of the family. Um, and some people like might move away from their family ward to avoid dealing with sensitive emotional issues, or they may use silence to distance themselves. Sibling position, um, that sibling position of married partners influence how they function as parents. So if you get married, you be you get married, the individual behave with their the way that you behave with your brothers and your sisters has a great deal to do with how you will react as when you're in a parental role. Okay, when it comes to societal um, emotional process, is the concept to indicate that the emotional process in society influence the same in families. So when we had the uprising over the summer with the BLM movement, you had people who were stressed out, and by that, because the country was stressed out, many families started becoming stressed out and they have an anxiety. So that's what goes on. Some of the key components of Murray's Bowen and multi-generational family therapy. What are some of the goals of family therapy under just in general? not specifically tied it all into Bowen. This is just in general. Um, to to decrease family anxiety so that the family members can improve their ability to function independently and reduce symptomatic behaviors. And two, to increase each family member's basic level of differentiation, helping each person to reduce effectively to emotional intense situations. Um, Development of development of behavioral disorders within the family. In Bowenian family therapy, individuals develop behavior disorders or psychological symptoms because the stress in their lives exceeds their ability to handle it. They get too stressed out and they cannot handle all the things, all the stimuli that's going on. Well differentiated individuals are resilient and therefore are more capable of handling stress. So the more differentiated you are, the more you are able to handle stress and the more resilient you are. And psychiatric symptoms of a family symptom develop when the level of anxiety exceeds the system's ability to blind or neutralize it. So the more anxiety, the more stress that is building up into a family, the family will be able to like maneuver and still carry on for the most part business as usual. However, when it becomes to where their cup overflows, then that's when you start seeing some real issues. The treatment process, the goal is to reduce the emotionality of a family. Therapists ask questions that promote self-reflection for one member at a time, and they work to reduce their own reactivity to a family's emotionality, and they avoid being drawn into triangle between family members. And finally, to detriangulate themselves from family, therapists do not take sides. Let me repeat that. To reduce their own issues, it is best that the therapist does not take sides and avoid taking sides. Okay. You usually encourage the family member to accept one personal responsibility for improving the family. Look at the five roles of being a therapist under Bowen family therapy. Define and clarify the relationship between spouses by way of using genogram. Um, Keep self triangulate from the family emotional system. Teach family members about the role of emotional systems and teach members the basic concepts of Bowen therapy. Demonstrate differentiation by the therapist's management of self during the course of therapy. And finally, help family members resolve emotional cutoffs. Some of the techniques when it comes to rules and Bowen family therapy. Um, First are genograms, and what genograms are basically a map of your family's history and generation and any themes that are there, whether they're racial, sexual, marital, divorce, social economic. So it's like those themes can also be put on a G-gram, so it'd be like a blueprint of what's been happening with this family for the past 3 generations. Um, Going home again, and going home again is basically like encouraging the family to work on establishing relationships between each individual and not just focus in on you're the problem, you're the issue, we need to go seek counseling because of you, but kind of broaden it out and kind of learn who each other is, like with differentiation. Okay. And detriangulation is when the therapist helps the family break down any triangles that are in the family, or might even be starting to work to where like they try to get the counselor / therapist involved. Detriangulation is that where you work on making sure that they stay in open communication with each other, especially the one that they might have issue with, and you build off of that communication. Um, Person to person relationships is kind of like what I just talked about, where they start establishing a relationship within the family. If they already don't have one, sometimes one reason they come in is because they don't have a relationship and they don't feel that is the way it's supposed to be, so they come in. Um, Differentiation of self is, how much autonomy do you have outside of the family, and asking questions. So that basically will cover our brief presentation on Bowen family therapy. I'm going to go over some in more detail in a couple of weeks, some more on Bowen, because it's very, very important. And so that's what we'll be doing. So take care